Hello everybody, this is Dr. Tyler Evans from Arete Chiropractic. Today I wanted to introduce you to a paper that just came out like in the last 2 or 3 months. It's titled Depression and the Craniocervical Junction, a look at the hemispheric model. Now, that's a lot of big words, but basically it means that they took patients who clinically had been diagnosed with depression and rated their scale on a depression questionnaire. It's called the Goldman questionnaire. And they did that pre and post 6 weeks of care for upper cervical chiropractic care. And what they did was basically they just did upper cervical chiropractic, regular upper cervical chiropractic procedures, and then applied a model of neurological understanding to the spine and the brain, how the spine affects the brain, to basically outline a narrative of why upper cervical chiropractic care might help with a thing like depression. Now, in this study, they showed that statistically significant improvement happened for these patients that had depression, which is really, really cool because there are a lot of people out there that suffer with depression. Now, when it comes to depression in the US, we tend to treat depression with drugs which have negative side effects. So, if there's a natural way that you can help the body work through depression and overcome that terrible problem, then that would be a good thing, right? And if you had a natural option, that would make sense to go for a natural option over medication that has negative side effects. So in the United States, we actually have, this is a study that was from 2017, so it's a little bit old, but the percentage of the US population over the age of 12 who took an antidepressant medication in the past month, according to analysis from the National Center for Health Statistics, was 12.7%. And most antidepressants are used to treat depression, while some others are prescribed for other conditions. But that's a fairly good chunk of people, right? And the increase, there's a 64%, the increase in the percentage of people using antidepressants between 1999 and 2014. So in 1999, 7.7% of the population took antidepressant medication. So that's wild. We have had a 64% increase in taking medication. Hey, Carrie. And so we've had a 64% increase in taking medication, and that's just in the last 15 years. That's crazy. Well, that was between 99 and 14, so pretty wild. And then if we look at the medications and what they do, so the most common one is the SSRI, so the serotonin reuptake, I believe, or selective serotonin reuptake inhibitors is the name of the SSRIs. These are the very common ones: Zoloft, Prozac, Celexa, Lexapro, Paxil, Luvox. Those are some of the most common ones, and they have negative side effects that include trouble sleeping, which in my life, when I don't sleep well, I have more, depressed thoughts and feelings and mood issues. Nervousness, which is definitely something that I'm sure that people that are anxious are trying to work on with these medications, as well as tremors, and then sexual problems. So some interesting, just obvious statistics there. And if we had a solution that was natural and drug-free, let's look at that. And so in this paper, what they outlined is that kind of the clinical way that the brain looks when you have a depressed state is that the left lobe of the cerebrum, the large part of the brain, the left lobe, is generally lower in function. It's less active. And then the right side of the brain is higher in activity. And that leads to this imbalance that then creates possibly this disorder of depression. And what they found is that most of the patients that experienced the greatest benefit under upper cervical chiropractic care were patients that they adjusted on the right side of the neck. Now, in chiropractic, there are studies that are neurologic based studies that show that when you adjust the neck, it changes the brain. And generally what happens is it will decusate, what's called decusate, is it will actually go up from the neurons in the neck and the nerves in the neck and the neurological system go across and then go up to the other side of the brain and affect that side of the brain. So if someone has a low functioning left side of the brain, you adjust them on the right, that left side is going to increase in function. Now, not everybody has a right-sided problem in their neck, so some patients got adjusted on the left, and those patients also saw a good, statistically significant improvement in depression symptoms. However, overall the right-sided patients did better in terms of their depression symptoms. So pretty cool study that was just done in the last few months. And if you have questions about that, if you're interested in finding out more, I mean, there are many things that cause depression, lead to depression. But hey, if your spine's out of alignment, I get grumpy when my spine's out of alignment. I don't feel great, so I'm not as gentle of a person, and I would say that probably goes for most people. And this is just kind of a great study that outlines that problem. So if you have questions, give us a call. Let us know if you need any help with anything, and we are here for you. This is Dr. Tyler Evans from Retake Chiropractic for our Research Live moment. We haven't done one in a long time. I've actually been doing a podcast with Dr. Kevin Leach in Seattle. We do a similar thing to this research review, but it's a little more in depth. There's a lot more breakdown of the paper, and I've been doing those for the last month or two, and those have taken up a lot of my time. But I'm going to make sure that I really get back at this because I think it's really important to get the research out there and show all the things that upper cervical chiropractic care can help with. So I hope you guys are doing great. Have a great day, and we'll see you soon.